46-year-old Lonnie Newton Rupert was found unresponsive in his cell at the San Diego Central Jail on March 17th of last year. He was taken to the hospital where he died. The initial report in 2022 did not give a cause of death, but did describe the National City resident as a repeat offender that had to be supervised. Now, nearly a year later, the medical examiner's report says Rupert suffered from severe mental illness and at the time of his death had pneumonia, malnutrition, dehydration, and COVID. His death has been declared a homicide.
The medical examiner, the deputy medical examiner, is not going to list something as a homicide if she is not convinced that it is, hands down.
Paul Parker is the executive officer of the County Citizens Law Enforcement Review Board. He used to be a medical examiner and investigator. He says these decisions aren't made lightly.
External factors played a role in the death. That's really what it comes down to, and that should not have happened, that someone had a duty to provide care, and that did not happen in this case. If we had jurisdiction over the medical care providers, that we would get the full picture of the deaths that are occurring.
The autopsy report says Rupert had a history of mental illness and refused treatment and care multiple times. He was one of nearly 24 people who died in custody of the Sheriff's Department last year. Sheriff Kelly Martinez says she ran on a platform of improving conditions inside the jails and on transparency. She says she immediately released the report when her office received it. But the most important thing to her is the victim's family.
First and foremost, I just want to say that my heart goes out to Mr. Rupert's family, his loved ones, and anyone who really is affected by this death.
Next, she says, if indeed this is a homicide, then the investigation she started last year that is yet to be completed will find that too.
Our homicide unit will finish their investigation and submit that to the district attorney for review. We're also going to be submitting that to the U.S. attorney.
Martinez says that about 10% of the jail's population need medical decisions made for them, but they can't legally do that.
We need to develop, new ways of helping these folks. Someone else needs to make the medical decisions on their behalf to keep them safe.
Martinez says she's committed to compassionate care for everyone in custody and feels that a separate facility for inmates with mental health issues would be the solution. They're in the process of hiring a consultant to see if that can be possible. Kitty Alvarado, KPBS News.